One of the things that I heard you mention was volume. How critical is it to take in the right amount of volume? And if there's too much, does that lead to dumping syndrome?
So the volume challenges can happen at different stages through the treatment. Early on, when people experience the narrowing in the esophagus, where food may not move through the esophagus efficiently, um, the bigger challenge is that food may back up above the narrowing in the esophagus. Um, and then people get that very sense of fullness. And many times, if the volume fills up too high, they may have to regurgitate their food to clear the esophagus. And so that's kind of the early issues. And once people have had the surgery, and they've had the anatomical changes related to the surgery where the stomach was used to reconstruct the esophagus, that's where problems with dumping syndrome may come in. And dumping syndrome can be a fairly common side effect of a post esophagectomy. Um, and it's just because of an atomic change. And it's usually not necessarily a volume issue, but it's more a clearance into the small intestine issue, um, where the chemical changes, it's usually more sugar containing foods, um, have a cascade of effects that may show up as palpitations, clamminess and sweatiness, um, even nausea or queasiness, or sometimes other digestive issues like just faster transit and diarrhea may be a consequence of dumping syndrome. And it's really important for people to early on start to pay attention to how does my body feel with the volume of food that I eat. So I really encourage people to have that awareness, pay attention when you eat. Try not to be distracted by conversations or TV or computer or activities where you don't pay attention to how your body tells you it's time to stop eating, and give it some time, let the food clear the esophagus, or it's time to stop this. The new esophagus can only hold so much, and give it some time before you resume eating.